Hi there, my name's Guy. I'm one of the senior physios over at Katie Bell Physiotherapy and Wellness. This is just a short video about some of my thoughts on lower back pain and an activity. I've previously worked in the NHS and then before moving into private practice in New Zealand and then here back in the UK, as well as working with some sports teams. With back pain, it affects everyone sometime in their life, and generally I find 95% of people with conservative treatment alone get better. So possibly some form of exercise and maybe some therapy, settle down nicely and crack on with their life. Back pain is a multifactorial problem, so there's many aspects that can contribute to your symptoms. So that could be the anatomy, so any kind of tissues affected, tissues that are sensitised, you may have overstretched or overloaded one slightly. What your lifestyle choices are, potentially if you're an inactive person or you're a little bit more of a sort of sitting on the sofa and more desk-based stuff, then that can again contribute to some of the symptoms. Your thoughts and beliefs and your psychology about what do you think has happened or what do you think you've done. Sometimes we can catastrophize the worst case scenario, and most of the time, 95+% of the time, maybe even 99%, it's nothing serious and it will settle down nicely with some conservative treatment, as I mentioned. Sleeping is a key aspect to that as well. If you're not sleeping well, that increases the sensitivity of your central nervous system, so your brain and your spinal cord, so symptoms can feel a lot worse than they actually are. And then any previous injuries that you've had, be it a twisted ankle or an injured shoulder, can sometimes cause you to adapt to altered patterns of movement that can sometimes potentially overload the hero of the body, which is your lower back. That will take all the strains of other bits, and then sometimes it eventually gets a bit grumpy that it's been working too hard, and then your brain processes that as discomfort. So from my experience, people who generally participate in regular activity or sports, so if that's going to the gym, doing classes, lifting weights, swimming, running, Pilates, yoga, dancing, even walking in the Peak District, generally have less incidences of lower back pain and normally recover a lot quicker than those who sit in an office, go home, sit on the sofa, and generally do less than 2,000 steps a day, for instance. We want to get you up, about and active, and you generally have less pain and you recover a lot better. And if you have got pain, you're able to manage that pain a lot better. So generally, as a physio, I recommend finding some form of regular physical activity that you enjoy, and if you can try and do that 3 times a week, so that's that regular aspect of it, that will really help reduce your symptoms and prevent them from coming in the first place. So find something that puts a smile on your face and that you enjoy, or you feel refreshed afterwards. And if you find something you enjoy rather than I really don't like going to the gym, you're probably unlikely to carry on doing that. Whereas if you love playing tennis or football, for instance, or running, you're more likely to continue and feel more motivated to do that. And if you can find a friend or a partner to do it with, that will help keep you motivated. If you're feeling a little bit low that day and your mate gives you a call and says, right, let's go out for a bike ride, you don't want to let him down, so you're more likely to get up and do it with them. So that would be really helpful as well. Moving on to the sort of rehabilitation side of lower back pain. So generally with physiotherapy, we like to be goal orientated. So we use a graded loading approach, which being more active and doing some form of sport or activity helps allow us to incorporate some of those activities or sports into the recovery plan. For instance, if your goal is to get back to playing tennis, to play tennis, we ideally need you to do some form of running, change of direction. So we need to have the strength to be able to do that. And then it's that graded approach to get you stronger at doing that. Now I can get back to running. Now I can change direction. Now I can go and play tennis and enjoy that. It's kind of part of that goal-orientated approach, and activity is great. And talking of activity, some pain during activity or exercise does not equal damage. The body is amazing at healing itself, and occasionally if the pain persists, sometimes the wires become a little bit crossed in a loop in the central nervous system, and the healed tissues that are from your lower back may become oversensitized, causing you to tighten up a little bit more. And a bit like making a fist, if your back's been working really hard and making a fist all the time, then eventually your fist's going to be sore or your back's going to be sore. So the information goes up to your brain as it's overstimulated, oversensitized. The brain processes that as pain, and then it says, right, I want you to squeeze a bit harder. So what we need to do there is, especially with back pain, we need to get you to switch off that those muscles in that area, let them relax. And calm down. So often I find doing some deep breathing work to just desensitize your nervous system, and then try and switch off those lower back muscles really helps with desensitizing the system and reducing your symptoms. And good news is that little loop that we were talking about, you can change that with a graded strengthening approach and graded loading. So the body and the mind will desensitize, and then that'll increase your confidence to get up and move about. As medicine is movement, it's nice and cheap, but sometimes you need to just gradually progress yourself into it rather than throwing yourself in at the deep end. So yeah, that graded approach is what we generally recommend. And so in summary, if you can find a sport or exercise that you love, keep